Hi hon, for my communication assignment, I'm going to present to you the heart. So I've got this really great anatomy book, and I'm going to show you the pathway of blood through the heart. Alright, so it's going to begin by blood descending from the superior vena cava or ascending from the inferior vena cava into the right atrium. After that, it's going to travel to the tricuspid valve through to the right ventricle, and you can see in the right ventricle there's features that are noteworthy to talk about. There's the trabeculae carnae, which are the meaty ridges over here, and then they're connected to that are the papillary muscles, which are connected to the chordae tendineae, which hold the tricuspid and the bicuspid valves shut whenever the ventricles are contracting. So once the right ventricle contracts, blood travels through the pulmonary semilunar valves into the lungs, and this is going to be deoxygenated blood. After blood gets oxygenated, it's going to travel through the right pulmonary veins or the left pulmonary veins into the left atrium. After that, it's going to travel through to the bicuspid valve, as we can see right here. So it's going to travel through to the bicuspid valve into the left ventricle, and this picture shows a comparison between the left ventricle and the right ventricle. We can see here that the left ventricle has an extremely thick myocardium, and that has to do with the fact that the left ventricle pumps oxygenated blood through the aortic arch. And so once the left ventricle contracts, oxygenated blood, is going to travel to the ascending aorta, to the branches at the top of the aorta, and then down the descending aorta, and then to the rest of the body. Alright, so we can continue to follow the pathway of the blood. Blood is going to descend from the descending aortic arch, and it's going to bifurcate into the common iliac artery, and then it's going to further bifurcate into the external iliac artery and the internal iliac artery. So this is an anterior view of the femur. We can see the external iliac artery is going to come down here, and it's going to become the femoral artery. And then once it gets a little bit lower, it's going to become the popliteal artery. And we can see that the femoral artery is going to come right behind the femur, and it's going to descend. And we can see that a little bit more clearly in this posterior view of the femur. See the femoral artery coming down here, and then the popliteal artery right behind the knee. And as the popliteal artery comes down posteriorly, it's going to split into the anterior tibial artery, and this artery is going to come right between the fibula and the tibia, and it's going to come anterior to the tibia. And then as the popliteal artery continues down, it's going to bifurcate into the posterior tibial artery, which stays right behind the tibia, hence the name, and the peroneal artery, which is going to come through the fibula and tibia and go just lateral to the anterior tibial artery all the way down. And as we travel further down the anterior tibial artery, it's going to become the dorsalis pedis artery right over here, and then the medial plantar artery is going to stem right off of that. Alright, so now we're going to go into veins. Here we have the dorsalis pedis vein, and then we're going to travel up, and this is going to be the saphenous vein, which is the longest vein in our body. And it's going to continue to travel all the way up, all the way up here, even further. So as the great saphenous vein ascends, it's going to connect with the femoral vein, in this case the right femoral vein, which becomes the right external iliac vein, and then which is going to connect to the right internal iliac vein, and it's going to become the right common iliac vein, and then the right common iliac vein and the left common iliac vein connect together to form the inferior vena cava.